Good morning, Peter Goertz. I'm a psychiatrist. Should I become a psychologist or a psychiatrist, you may be wondering. I'm a psychiatrist, but I'm considering becoming a major motion picture star. I hear the money is good. I'm just playing. So, psychologist or psychiatrist, for being a psychologist, you'll need a bachelor's degree, and then ultimately you can get a PhD, or what we call in America PsyD, PSYD, so a doctorate degree. As a psychiatrist, you'll need a bachelor's degree, you'll need to go to medical school, and you'll need to do a psychiatry residency. So that's quite a few years. So for the bachelor's degree, 4 years, for the medical school, 4 years, for the residency, 4 years. As far as salaries, you'll make reasonably good money as a psychiatrist in the US. Maybe the average now is something around $240,000 a year. As a psychologist, you'll on average be making less money. As a psychologist, you'll be able to do psychotherapy, you'll be able to do psychological testing, and some psychologists work in other settings like industry. As a psychiatrist, you'll be able to do psychotherapy, psychotropic medication management, or what I find very nice is to do both. So you can see some of my patients, a certain percentage, maybe 20%, 25%, in the clinic that I see for both medication management and psychotherapy. So they have sessions of about 45, 50 minutes, and we work on the medicine and we work on the psychotherapy. And that, I think, is a nice way to do things. At least I enjoy it. And I think for the patient, it's also good in the sense, well, for various reasons. But I think one advantage is they don't have to go to two different people. It's like one-stop shopping, so to speak. And also, I think sometimes it's helpful for the patients, especially if they're suffering from serious medical issues. Sometimes it's good for them to have psychotherapy with someone who understands more or less where they're coming from medically. Other things you can do as a psychiatrist is work in an ER, you can do consultations on medical floors. Both a career in psychology or as a psychologist and a career as a psychiatrist, in my opinion, can be very fulfilling. You're going to have the privilege of meeting various patients from different walks of life, and that to me in itself is very enjoyable. And as far as downsides, potential downsides, as a psychologist, you in general will not be able to prescribe psychotropic medication. You would have to, in general, refer a patient who you feel might need medication to a psychiatrist. Now, there is an exception, which I'll address in a few minutes. As a psychiatrist, one potential downside, depending on how you look at things, is you're going to be constantly learning. You're going to have to constantly memorize for the rest of your career and do your best to keep not only your psychiatric knowledge, but your medical knowledge up to date. And you're going to have quite a bit of responsibility as a doctor. And for example, you're going to have bad outcomes at times. So if you prescribe a medicine and the patient has a very bad, dangerous, potentially side effect, that can be problematic and can be difficult for the psychiatrist to cope with sometimes. Other options, if you're thinking of, if you're mostly interested in psychotherapy, you might want to consider a career in social work, because you could do psychotherapy as a social worker. In fact, in our clinic, many of the psychotherapists that work in our clinic are social workers. The downside, or a downside, with being a social worker is you would have a salary that is a lot lower than that of a psychiatrist or a psychologist, or a nurse for that matter. You could be, at least in the US, there's a profession called licensed professional counselor. You could also do psychotherapy. And the salary I'm not sure of, but I'm pretty sure it's quite a bit less than what a psychiatrist earns. Other potential options are if you're, for instance, interested in prescribing psychotropic medication, you could become a nurse practitioner, so you'd have to get an RN first, and then become a nurse practitioner with additional training. Or if you want to prescribe psychotropic medication, you could also become a physician's assistant, so what we call a PA in America. And those professions, nurse practitioner and physician's assistant, routinely in our clinic prescribe psychotropic medications to patients, and I think they make a reasonably good salary, so quite a bit of money. In some states in the US, there is the possibility for psychologists with additional training to prescribe psychotropic medication. And in the state where I work, that is possible. So there are prescribing psychologists, and that for some psychologists apparently is enjoyable, and that way they can also do both for a given patient. So they can see a given patient for psychotherapy and for psychotropic medication management. One potential downside from my perspective as a doctor is potentially you could miss things because your training might not be enormously extensive. As a prescribing psychologist, your medical training might not be enormously extensive. Let's say if a patient needs an EKG and you get the EKG reading, it may not be entirely clear to you what the EKG reading signifies. That's one thought I have. So I would be concerned myself as a psychologist whether it's a good idea to prescribe or not, but I'm sure different people have different opinions, because potentially, in my opinion, if you prescribe as a psychologist, you might be more vulnerable to legal action because you do not necessarily have extensive medical training. And if something medical goes wrong, let's say as a side effect of the medicine that you're prescribing, you might be more vulnerable. Of course, again, I'm sure there are different opinions, and I want to keep an open mind. And there are psychologists who are prescribing psychotropic medications in some states in America. Thank you.